All right, joining us now is Wish TV's medical reporter, Dr. Mary Gillis.
All right, today we are talking about alcoholism, Mary.
We are, yes. Kind of sort of a serious subject. We have a solution here, okay? All right, so let's get started. So, yes, I've done a series of stories about alcoholism and how alcoholic deaths are on the rise by 25% this past year. And then I did a story where I spoke with an addiction specialist who said, and these are her exact words, recovery is 100% possible. And I kept doing some research and I found there is no such thing as what we call a typical alcoholic. In fact, a collaborative study by the National Institutes of Health on alcohol abuse and alcoholism and the NIH, among other organizations, conducted a national clinical study and found there are 5 subtypes of alcoholics. All right, so let's take a look at the first one. Okay, the young adult alcoholic makes up 31% of all alcoholics. They begin drinking at age 19 and become dependent by 24. They are binge drinkers, which means 5 or more drinks for men and 4 or more drinks for women within 2 hours. 2.5 times more likely to be males and typically cannot sustain employment. Next one, functional, about 20%. Things look great on the outside. They're married, they have a job, the highest level of education. No one would know anything is wrong. They typically start drinking at 18 and become dependent by 37. This group is the least likely to seek help. Intermediate, okay, again, 20% tend to start drinking at 17 and become dependent at a younger age, dependent around 32. It's very likely alcohol runs in their family. These addicts are usually sort of antisocial, have anxiety or depression, and suffer from high rates of addiction to other things like cigarettes, marijuana, and cocaine. Okay, young antisocial. This group tends to start drinking at around 15 and become dependent at age 18. They also tend to suffer from antisocial personality disorders and other addictions similar to the intermediate types. They have the lowest level of education. They drink less frequently but binge when they do. However, this group is the most likely to seek help. It's a great thing. Okay, chronic severe, small percent, just 9%, start drinking at 15 but become dependent a little later on at 29. This group has the highest percentage of family members who suffer from substance abuse. They are the most likely, they're most likely the group to experience major depressive disorder, bipolar disorder, generalized anxiety, panic disorders, social phobias, and this group drinks the most if not all days of the week, and they binge. However, they seek treatment, inpatient programs, physicians, psychiatrists, and mental health professionals.
Oh, wow, cool.
Yeah.
It's interesting to be able to see all of them listed like that.
Wow.
You would never know. I mean, the thing is, it was so interesting parsing out these different types, and people. I always wonder. So what I want you guys to do is to go to wishtv.com, as seen on Wish TV. There is a story already up there where I did. Previously, where you can take a quiz to find out if you drink too much. There's a story up there about how and why recovery is 100% possible, and there are resources. And I always wonder, you guys, if this is an addiction, why isn't there on the beverages, these bottles? This you can get addicted here. Okay, let's call for action. Public health issue.
Absolutely.
Yeah.
I think the thing with alcoholism as well is that it impacts so many people, and I feel like it's kind of gone to the wayside. We just don't talk about it.
Yeah, we don't really
No
get
shame.
into it at
No
all.
shame, guys. No shame. You're not alone. Okay. Thank you
Well,
both.
Mary, thank you.
Thanks, Mary.
Feel a little bit smarter today.